Hello, everyone, and welcome to Teen Depression and Autism, Unique Challenges and Effective Strategies for Support. My name is Lisa Meekum, and I'm a volunteer with Families for Depression Awareness, and I'll be moderating today's webinar. In a minute, I'm going to introduce our presenter, Dr. Sara Rodrigues, but just a few housekeeping items first. We've got a poll that you should see popping up on your screen. If you'd like to answer that, we would love to hear what you have to think about your confidence in knowledge about depression and autism. We welcome you to ask questions through the Q&A feature throughout the program, and we're going to do our best to answer as many questions as possible by the end. This program is being recorded and will be available to watch immediately after it airs. We're also going to share a survey at the end of the presentation, and we'd really appreciate it if you could fill that out so that we can evaluate our webinar and design programs for the future. I'd love to tell you a little bit about Families for Depression Awareness. Our mission is to help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. Our philosophy is that when a person is living with depression or bipolar disorder, it's the people around them, the parents, the siblings, the grandparents, the friends, all of those people in their lives that have a strong and powerful position to support that loved one. Yet caregivers don't always know what to do. And that's where Families for Depression Awareness comes in. We provide education, training, and support specifically geared towards family caregivers so that they can be a strong advocate for their loved ones, a partner in care, and most importantly, so that we can support family units, because that's what we really believe helps to improve health outcomes. The hub of our resources is our website, familyaware.org. You'll find a wealth of free resources, including online tests, family stories, webinars, and more. Consider signing up for our newsletter so you can stay connected with us after this program. Again, you can visit the website, familyaware.org, or scan the QR code on this slide to sign up. I'm going to share our agenda for this webinar. We're going to be framing our topic, recognizing depression in autistic teens, treatment strategies that respect neurodivergence, proactive mental health supports, practical takeaways, and then the Q&A and the survey. I would like to introduce our featured presenter. Dr. Sara Rodrigues is a clinician, educator, and disability justice advocate with over 20 years of clinical practice. She is the executive director of the Balanced Learning Center, a nonprofit focused on neurodiversity affirming therapy and community programming, and the CEO of Neuro Harbor Wellness and Consulting, as well as an adjunct professor at Boston University and the University of Massachusetts Global. Dr. Rodrigues specializes in supporting neurodivergent individuals, particularly those navigating trauma, education systems, and structural barriers to care. Most importantly, she is a mom to 3 incredible kids. Her work blends clinical expertise with lived experience and a commitment to systemic change. She is passionate about dismantling deficit-based models and replacing them with relational, affirming, and accessible approaches that center client voice. I'd like to welcome Dr. Sara Rodrigues and turn it over to you.
Could it be any more awkward to sit and listen to someone talk about you? So thank you so much. I am really happy to be here tonight because this topic in particular is something that so many families feel, but don't always have the language for. So what happens when an autistic teen is struggling and we're not sure if it's anxiety or if it's burnout or if it's depression or if it's something else? The reality is that we often miss depression in our autistic teens because it doesn't always look how we expect it to. So one thing right off the bat that I want to point out is you may have noticed the language that I'm already using. So the language I tend to use is identity first language. I tend to say things like autistic individual, autistic person, autistic teen. And that is extremely different from what most of us have been taught about how we talk about folks in disability. The reason I use that language, it's because that is the language that the autistic community specifically has requested. So it's sort of this reclamation that autism is not something to be feared or shamed, and it's just a part of their identity. Depression is something different. So you're not going to hear me say depressed teen because that is not a part of their identity. But the autism is just a descriptor of how their brain works. So that's why we use that language. Why are we talking about this? We know a few very important things. And I'm going to say something directly because there is a very big misconception here. There's this idea that autistic teens don't experience things like depression or anxiety. Autistic teens are not immune to mental health issues, including depression and suicidality. In fact, we know that they are at higher risk than their non-autistic peers when it comes to these things. We know that about 50 to 70% of autistic people experience co-occurring mental health needs like anxiety, like OCD, like depression. We also know that they are about 3 times more likely to experience depression. One of the other things we know is that about 34% of autistic folks have experienced suicidal ideation, and about 24% have made at least one suicide attempt. So I don't share this to scare you. I share this so that way we can all be more aware. So that's really what we're going for here. Why do we see some of these risks? Part of it is that some of it is neurological, right? A lot of this has to do with how the brain processes information. Autistic brains tend to take in more information at once and have a harder time filtering out information that many of us already do automatically. So it takes a little bit longer to filter out what's not important and process sensory information. So imagine going through your day without a filter. Everything is louder. Everything is brighter. Everything is more unpredictable. That moves us past the point of discomfort and toward this piece of chronic nervous system activation. Then we layer on things like cognitive processing differences. Many of our autistic teens tend to think more concretely, right? They have a strong need for predictability. They might need support in shifting their attention or shifting their perspective in things. So when something goes wrong, it goes beyond the idea that this is hard. It can feel a lot like this is always going to be hard, or I can't fix this, or I'm a failure. And that's the kind of thinking pattern that we see in depression. But here, it's interacting with how their brain is wired to actually process information. So on top of all of that, we have to talk about environment. This isn't just about how our teens are wired internally. Many of our autistic teens are navigating constant social demands. They are trying to navigate spaces that are not built for their sensory needs. And there's a lot of pressure for them to mask or to sort of fit in, right? And that creates this feeling of chronic stress. And over time, chronic stress turns into exhaustion and disconnection, and for some kids, depression, right? So when we put all of those things together, we've got a nervous system that's taking in more information. We have a brain that is processing information differently, and we've got environments that just don't fit. We get a group of kids who are more vulnerable to depression, and they are less likely to have it recognized. So what that means in real life is that our kids are struggling and we're not always catching it early. And by the time that we do, things are much more intense than they ever needed to be. Okay. Before we go any further, I just want to pause here because most of you are not starting from zero, right? You've been here already. You're already noticing that something is different about your teen right now. And often the hardest part isn't that they're struggling, it's figuring out what you're actually looking at. So I want you to think for a second. If your teen is struggling, what is the thing that makes you pause? Is it the mood changes? Is it increased irritability or sort of this rigidity in thinking? Is it withdrawal? Is it shutdown? Right? Is it changes in how they're sleeping or their energy levels? For many of our kids, it's probably not just one of these things. It's a mix and it can really shift day to day. So, what we hear from families all the time is that they know something is off, but they're really uncertain about what it is because the signs that they're seeing can be signs of depression, but they don't always look like we're taught to look for. Okay. There's three big reasons why depression gets missed. The first is something called diagnostic overshadowing. And all that means is that we explain everything we're seeing through the autism. So instead of asking what's actually changed for our kids, we think this is just how they are because they're autistic. I can tell you a personal story. This happens all the time. Full disclosure, I do have an autistic teen myself. I remember bringing him in with actually eczema, right? Very common skin condition. And I very clearly remember the doctor telling us, well, he's autistic. That's where the eczema is coming from. That's what diagnostic overshadowing is. Everything is attributed to the idea that they are autistic, right? We know that eczema and autism are two separate conditions, just like depression and autism are two different conditions, okay? So when that happens, we stop looking deeper. We stop looking for the reason behind something. So the second is very closely related, but we normalize things that might actually be signals. So things like social withdrawal or irritability, difficulty shifting activities or their thinking, right? That gets interpreted as that's just their personality, or this is just what their baseline is, instead of asking, hey, is something different actually happening? Is this happening more often than usual? Right? And the third piece is masking. So we could go on for hours to talk about what masking actually is. A lot of our autistic teens are working really, really hard to hold it together all day. So what you might see is they get through the day, they say at school, and then they completely fall apart at home. Or they might look fine on the outside, but internally they are exhausted, they are overwhelmed, they are shutting down. I'm going to say this very directly. A lot of these kids are not fine, right? They're just very good at hiding what their feelings are, or they're really good at tamping them down enough to just be able to survive the day. Okay. So masking over time can lead to things like depression and suicidality, because imagine going through the day always having to act like somebody that you're not, always trying to hide the qualities that are true about yourself in order to feel accepted. Not that you are accepted, but in order to feel like you are. Right. So this is part of the issue. So we're going to stop right there. When you first notice that your teen is struggling, what is the hardest part to interpret? You should see a poll up on your screen. I'm going to give folks a sec to answer that. First, notice that your teen is struggling. What is the hardest part to interpret? We'll talk about that in a second. Right? And feel free, if there's something on this list that is not what you're seeing, feel free to put it in the chat. I encourage you to put it in the chat. We all learn best when we learn from each other. Okay, so lots of folks are saying that they're noticing more of the withdrawal or the shutdown. Looks like increased irritability or rigidity comes in next, and then some mood changes. So notice that the mood changes, that sadness that we sort of expect to see, is not the thing that people notice more. They're noticing the withdrawal or the shutdown the most, right? And that's oftentimes what happens. One thing about sleep issues, yes, this is an issue that comes up in depression a lot. One of the reasons why it gets overlooked in our teens is really because sleep issues and autistic folks, they tend to go hand in hand, or because our teens have differently wired sensory systems, their sleep systems are often differently wired. And so what's sort of always been a struggle is then a little bit more difficult to decipher if there's actually a change, right? We've got folks in the chat saying that an increase in sort of tics is huge for their son. I can tell you that families have also shared with us that they've noticed changes in stimming behaviors, and we're going to talk about that in a minute. So this is what the DSM tells us to look for. So for folks who aren't familiar with it, the DSM is the Diagnostic and Statistical Manual of Mental Disorders. It is the sort of the Bible of what therapists use in order to diagnose. So there's multiple diagnoses in there with different diagnostic criteria. And this is what it tells us for depression. So it tells us that we should see a sad or low mood. It tells us that we might see changes in sleep or appetite, significant weight loss or weight gain, a lack of interest in activities, fatigue or a loss of energy, trouble concentrating, low self-esteem, or thoughts of suicide. So those are some of the things that are in the DSM. It also tells us that these things have to be present for at least 2 weeks to make a diagnosis of depression. And these are real, and they absolutely can show up in our autistic teens. But if this is the only lens that we are using, we are going to miss a whole lot of kids that don't fit this mold. Your teen probably isn't saying, I feel sad, right? And so that list might throw you off a little bit. So this is where we start to shift our lens. We start asking things like, hey, what's actually changed for my kid? You might see them pulling away more than usual. You might notice that it's not just about them wanting alone time or they just don't want that time to recover, that they're actually having a harder time re-engaging the way that they used to. You might see things like more irritability or more rigidity. And this is a really, really big one because it often gets interpreted as a behavior issue. We see this happen quite a bit, right? The tone of voice changes, their ability to follow through on tasks is different, their ability to complete schoolwork, that's a big one, becomes very different. To even get to school becomes a little bit of a challenge. But irritability is how depression sometimes will show up when someone isn't expressing that level of sadness or low mood directly. You might see things like heightened sensory sensitivity. And so this is another big issue that comes up with our autistic teens. We know that our autistic folks are wired a bit differently when it comes to their sensory system. And the way I tend to describe it is that you are headed down the highway in a allegedly typical sensory system. And the only way that you're going to get off the highway is to take an exit, right? Those are sort of those sensory distractors. In an autistic individual, sometimes what happens is that their sensory system goes through the back roads. So there are lots more input. There's a whole lot more information that's coming at them. And they're noticing a whole lot more because there's lots of twists and turns in their journey. So they're processing so much more information than their peers are not processing. If we look at how much information folks are taking in, we know that the human body or the human brain will actually take in about 11 billion pieces of sensory information every second of the day. 11 billion. I did say that correctly. Now, a person who is not autistic or a person who is not neurodivergent or disabled in some way will process actively about 40 to 50 of those pieces of information. So that's things like the lights that are on, the temperature in the room, whether or not they're hungry or thirsty or need to use the bathroom, how their body sits in the chair, right? All how their clothes feel on their body. Those are some of the pieces that they're taking in. An autistic person, a neurodivergent person, will take in anywhere from 3 to 5 times as much. So they have to filter through all of that in order to get at what's really important in that sensory info. So when we see heightened sensory sensitivity, things that might have been more manageable before, things like noise, transitions, social situations, they suddenly feel so much more overwhelming and so much more unmanageable. You might also see changes in passions and interests. So this could look like a loss of interest in something that they really used to love, or sometimes an even more intense focus, but it's in a way that feels more isolating than regulating. So I can tell you that in our house, one of the things that is a huge, huge interest, a deep interest. I don't like the term special interest because everybody has things that they love genuinely. But one of the things that's a big thing in our house is a love of production companies for movies. And so there's a probably 2000 DVD collection of Disney DVDs and Universal DVDs and all those kinds of things that are in our home. We know when something is off if there is a hyper fixation on those things, more so than what actually brings him joy, or if he's not interested in all. So I want you to start paying attention to what that level of interest actually looks like. And is it bringing them joy anymore? Is it regulating for them? Or is it feeling more isolated? Is it feeling more frustrating for them? Right. So those are some of the pieces that you might see. You also might see fatigue, right? So low energy, there's trouble getting settled. They're needing more downtime. I joke that I myself need a good 3 to 5 business days after any social interaction in order to recharge. But our autistic folks may need more time, right? And it's not just being tired. It's that things feel genuinely so much harder to do, so much harder to engage with. You might also notice some very concrete all or nothing thinking. So things like nothing is ever going to change, or I am never going to be able to do this, or I always mess this up, right? So you might hear some of that communication. Sometimes it's going to show up in the body. It's headaches, it's stomach aches. It's just that sense of kind of feeling off and not really knowing what to do. So when we look at all of this as a whole, it doesn't always look like sadness, right? It doesn't always look like that low mood. The most important shift that you can make is this different from my teen's usual presentation? Our teens are communicating how they feel. It just might not be in a way that we expect. So that makes it a little bit harder to recognize. Okay? So now we're going to look at how do we differentiate between what's burnout and what's anxiety and what's depression. What's interesting is that there's actually a specific type of anxiety that is related to autistic individuals. It's not in the DSM, but there's a lot of research around it right now, and it's really just called autistic anxiety, and it comes from having to navigate systems that are not built for them. Right. So how do we try to figure some of these things out? It's hard because so much of it overlaps, right? Burnout, depression, anxiety all look really similar on the surface. So let's start by looking at burnout. So burnout comes from a period of chronic stress and a mismatch of expectations and abilities without supports. So it tends to look a lot like exhaustion, a loss of function, the need to withdraw, the need to recover from things that were once just really manageable for them. We tend to look at burnout when we've seen this presentation for about 3 months, right? So I started with the most intense, and that's what we're talking about here. It takes a long time to recover from burnout because this is something that's been building for a long, long time, okay? Anxiety, like we've talked about, what that looks like is this persistent worry. It's this feeling of I'm afraid of what's going to happen next. It's this feeling of impending doom. It's the sense that I don't know how to navigate this situation, not knowing what really comes next. Autistic anxiety can also come, like I said, from feeling like you are constantly navigating situations that are not built for you. So it's a lot of trying to basically learn the language that other folks are trying to give you. One of the other things that happens with our autistic teens in anxiety comes from sensory anxiety. It's sort of that really intense anticipation of how am I going to navigate this situation that I know is going to be intolerable for me. right? So that's what some of those pieces are going to look like. Depression looks more like some of the things that we just talked about, right? It's those changes in interests. It's that heightened sensory sensitivity. It's the changes in stimming. It's the more frequent shutdowns or meltdowns. We can call it whatever we want. The important thing to figure out is, when do we seek support for and with our teens? Okay. My go-to rule is, anytime that you feel like something is different from their usual presentation, you seek advice every single time. Listen to your gut, be that parent. If the changes that you're seeing have gone on for more than a couple of weeks, that is absolutely a reason to seek support. If you're suddenly seeing a major drop in their ability to go to school, not just one day that was kind of tricky. We're talking about, a difference here. If you're noticing that they're isolating a lot more, they're sleeping, they're eating, their hygiene habits are noticeably different, that's a reason to seek support. If you're noticing any kind of expression of hopelessness, of worthlessness, and sort of what's the point kind of thinking, that is a reason to seek immediate support. Or if you're noticing self-harm behaviors or expressions of death or suicide, that's when we need to seek immediate support. Okay. Anytime, again, I go back to this, be that parent, it's okay. Anytime that you feel like something is very different from their baseline, that's when we seek support. It is okay to ask. Right. I'm going to stop right there, and I'm just going to pause. I'm going to reiterate what Lisa put in the chat. Feel free to type any questions that you have. We're going to try our best to get to them. But if things are coming up for you, then I want you to be able to mention them so that we can make sure that we address them. Okay. I also know that when we start talking about depression and suicide, folks really start to get nervous. It becomes very overwhelming for folks. Okay, so I just want to acknowledge that and take a second before we move on and take a look at our autistic teen here. So what we have a 15-year-old autistic teen, and I'm calling him a he. I actually named him Jordan in my case study. He is a kid who is historically really engaged in school. School was great for him. Had a very strong interest in gaming and art, and really just loved going. He had great relationships with teachers and with peers. Over the last month or so, what we've noticed is that he's really struggling. And every time he comes home, he's withdrawing a lot more. He's spending more and more time alone in his room, and he's playing video games, which, for that age group is not all that unusual. But still, we want to be clear that this is something that is outside of his norm. We are noticing that he is extremely irritable when his routines are changing. Whereas before, you could kind of give him a heads up and he would be okay with it. He's complaining a lot about fatigue and about headaches, right? And that's been a huge struggle for him. He's never had a depression diagnosis. He's never had an anxiety diagnosis or anything like that. So what we're seeing at school right now is that he's not doing any of his classwork. He's not completing his homework. He's not participating in class discussions. He's not engaging the way that he used to. And so what's happening is the family is getting phone calls and emails saying that he's non-compliant, right? There's a lot of refusal. He's intentionally not getting his schoolwork done, right? So there's a lot of this language around this is what's happening for him. So I just want you to stop and think for a second. Have you ever seen something like this happen in your teens where you're noticing that these are the things that are happening, but what's coming up is that they're being labeled as they're refusing, they're non-compliant, they're not engaging, they're being difficult. Have you ever heard something like that? I just want you to think about that piece right there. Right. I know that I hear it every day from families, that families are telling us that, these are the calls that they're getting from schools, that these are the information that's happening. This is the things that they're noticing, and what they're saying is that they're feeling really strongly that this is related to them having to mask throughout the day, that the environment is getting more difficult for them to manage, and it's becoming harder and harder for them to be able to kind of get by, right? And so what's often seen as just this behavioral piece is really around depression, but nobody's looking at it because we have an autistic teen. So this is what it could actually look like in real life. I can tell you that this is a study that's pulled from my own experience with working with families. These are the things that are popping up for folks, right? This is where it's first being noticed, is in school, right? I see some absolutely's in the chat, right? Feel free to use the chat, and it's hard for me to sit and talk at people as opposed to talking with people. And so feel free to respond to any of my random questioning here. But if you've ever noticed this with your teen, please feel free, put it in the chat. I'm happy to talk through that. This is sort of what our presentation, this is how things get overlooked in our teens, right? He's never had a depression diagnosis. He's autistic. So therefore, some of these things must be considered, and I say that very facetiously, must be considered to be just a result of their autism as opposed to what's going on emotionally. Right? I can tell you on the flip side, what came down from it is that there was a falling out with a friend. And so a lot of the increasing withdrawal and that need to be alone and the irritability and the somatic complaints of fatigue, the headaches, that kind of stuff was actually coming from that and not a result of just a behavioral decision, right? Depression is not a decision that people make, right? Okay, so we're going to move into talking about some strategies here. So we have another poll here for you. If you were to try to seek mental health support for your teen, what is the biggest barrier to getting mental health support that feels like a good fit? Is it finding an autism-informed therapist? Is it that your teen's not going to engage in talk therapy? Is it trying to schedule into your own busy schedule, or is it something else? And if it's something else, please feel free to put it in the chat. All right, Gwen, I hear you. That's how it started for your daughter. White knuckling it ever since. It's probably it's probably one of the best descriptions that I've heard about what that actually looks like. They're white knuckling it, right? And it's really difficult to find proper help. Exactly. Finding an autism-informed clinician and getting her to participate. You don't want them to feel different. I know what you meant, Gwen. I know you meant a therapist. That's fine. Right. So let's see. So finding an autism-informed therapist, that is the biggest piece right there. That is the biggest challenge. So I'm going to tell you a little bit of information about that in a second. The teen will not participate in therapy. You just can't get them to go, right? That's the other biggest barrier. So what's interesting about this generation of teens is that they are much more open to accessing therapy. At least here in the Northeast, I can tell you that when we work with teens, we hear them talking amongst each other about their therapists. Sometimes they even give referrals to other teens about therapy. It's kind of great to see. They are much, much more open. Kayla, I hear what you're saying. Your teen would be willing to go, but you get very short answers out of them, right? If it's not asked, it's not told. They're very concrete, very direct. I hear you on that. Finding an autism-informed clinician is really difficult. So I can tell you that when you go to so most therapists have either gotten a degree in social work or they've gotten a degree in clinical psychology or counseling, usually one of those three fields. There are others, but typically it's one of those three. And I can tell you that most of the curriculum in those higher education programs don't really center autism and they don't really center disability at all. And so the little information that we get is more so around things like case management or care care coordination. And I say this, as somebody who's done the research, there's actually less than 1% of course content in master's programs around how to adapt programming or interventions for disabled individuals, autistic individuals, and most of the work is really around that case coordination piece. And so that's part of the reason why, right? Autism in particular was always seen as something separate. One of the things that we hear from families all the time is that the moment that if they call a mental health organization and the moment they say that their child is autistic, the answer is often, we can't respond to that. Right? We can't help you with that. That's not our area of expertise. So as we move into treatment strategies, I want you to think about some of the traditional depression options. So these are some of the approaches that families are going to be offered if they can get in anywhere, right? So first is talk therapy. It's most often something called cognitive behavioral therapy, CBT. You might hear that a lot. It's often touted as the gold standard of treatment for depression. CBT is a very structured type of therapy that focuses on the connection between our thoughts, our feelings, and our behaviors, and it'll teach clients the skills that they need to shift those patterns. There are countless other approaches to treating depression, but CBT is one that you're going to hear a lot about. Talk therapy definitely helps with building strong, healthy coping skills, challenging negative thought patterns, shifting perspectives, among many, many other things. Medication is often prescribed because it can support how the brain regulates mood, right? So medication will work on neurotransmitters like serotonin, which play a role in mood, anxiety, and emotional regulation. So for some teens, it can actually reduce the intensity of symptoms. It can improve mood and energy a bit, and it can make it just a bit easier to engage in life and in therapy. So sometimes it is the thing that's helpful to kind of get over that initial hump in order for them to be able to engage. Medication is not a quick fix. We've got to be very, very clear about that. It usually takes 4 to 6 weeks to notice any changes, and it can take time to really find the right medication and the right dose. Most of the medications that get prescribed for depression are what's called selective serotonin reuptake inhibitors, SSRIs. Right? Medication, really important to note, is that it does not teach skills, and medication does not address the underlying stressors. Those stressors are still going to be there. But what it can do is create enough stability that the other supports, like therapy, can actually become more effective. Okay? So those are some of the traditional things that we see. I want to be very, very clear in what I'm saying next. Standard therapy modalities are very strong. They are evidence-based, they are research-backed approaches for the treatment of depression. Okay. With that said, our autistic folks often need something a little bit different. Okay. A lot of therapies heavily, heavily rely on talking, right? You're talking about thoughts, you're talking about feelings, you're putting words to what's happening internally. For some teens, that's not the most natural way for them to process. They might have a decent sense of what's happening for them, but we're asking them to show it in a way that might not work for them, right? We have folks that don't use oral verbal language or mouth words in order to communicate, right? We have folks that communicate in very, very different ways. So it's not unusual for our autistic teens, or anyone for that matter, to also lose access to language when they're distressed. Right? So here we are, we're asking them to engage in something that they just don't have the capacity for, right? Another gap that we often ignore is the role of the body and the environment. So if someone's overwhelmed, whether it's sensory overload, there are multiple transitions, there's a lot of social demand, their nervous system is already dysregulated. And when that happens, there's no amount of cognitive work that's going to land for them. That's just not going to happen. So we're trying to solve a nervous system problem with a set of thinking strategies. Okay. And the third piece is that some approaches focus really heavily on behavioral compliance. So the goal is to reduce behaviors or increase participation, and this is through things like reinforcements and consequences. The core issue in depression, though, isn't motivation. It's not willingness. This isn't something that someone's actively choosing to do or not do. It's really a capacity issue. So we're not addressing what's underneath all of that. And in a lot of cases, we're actually teaching the teen to push through distress instead of helping them understand and regulate it. So increasing pressure often increases that level of stress, of withdrawal, or shutdown. You cannot reinforce someone out of depression. It just doesn't work that way. Right. So I want you to think of it in terms of, have you ever been so frustrated, so upset about something and somebody told you to calm down? How does that go over? Right. Just want you to think about that for a second or put it in the chat. Typically, it doesn't go over well because if you could calm down, you would. Right? It's the same thing in depression. When you're pushing someone really hard, right, it makes me a little bit more angry too. I don't know if you could read my face. I'm not really good at hiding my facial expressions. But if somebody tells me to calm down, I can promise you the last thing I'm going to do is calm down, right? It's very much similar though in depression, right? Like, why are you so depressed? Life is so beautiful. There's so much that there's out there that you could engage in, and it could be so much better. And yes, that might be true for some people, but telling someone that doesn't change it. And that pressure can often make things much worse. Okay. So one of the most important shifts is really becoming more sensory informed. So that starts with the idea that before anything, we interpret our teens' behavior through that sensory load, right? Very exactly, Dale. Very, very hard to calm down in a moment. So when we're looking at sensory informed care, we ask what's happening in the teen's environment right now. Is it loud, right? Is it too bright? Is it unpredictable? Are there just too many demands for this teen? Then once we figure that out, we adjust the environment. So that might look like we're reducing noise or visual clutter, or we're giving more time for transitions. We're building in some predictability. We are temporarily, hear me when I say temporarily, lowering demands, right? These aren't accommodations in terms of where I'm trying to make things easier. They are what actually allows the teen to access the environment in that moment, okay? When we can support regulation through the body, things like regular movement and rhythmic activities like swinging and rocking and deep pressure, maybe it's wrapping up in a heavy blanket, using resistance, like pushing against a wall or doing slow, controlled movements, or even a tight hug, if that's something that your teen actually finds comforting. That can be very calming when we can actually engage in some of those things. So the key has to be something that they find regulating, not something that you find regulating, because what's going to work for one person isn't necessarily going to work for another. So it's really up to us to sort of play detective a little bit to see what kinds of sensory inputs can actually be really calming. For one of my kids, a deep, tight hug is exactly what he needs. He calls it, I need a squeeze. For one of them, a deep, tight hug would be a sensory nightmare, and that would make things so much worse. And if you notice my face, I'm already kind of laughing thinking about it, because he would absolutely lose it if we tried to do that in order to help him calm down. The next shift that we want to make is really becoming more communication responsive. So a lot of what we think of as a lack of engagement is actually just a mismatch in how communication is happening. So the first thing is processing time. So a lot of autistic teens, a lot of autistic people need more time to understand what's being asked, right? They need to be able to process what they're feeling, figure out how to respond. There's a lot of steps there. So if we ask a question and we expect an immediate answer, we might get a whole lot of, I don't know, or there's no response, or they ask you to repeat the question, or they shut down. There's some studies that show that it takes autistic folks takes non-autistic folks, roughly about 30 seconds to understand a question, to recognize a response, to express it. I said that backwards. I'm going to rephrase that. There is some research that shows that it takes autistic folks about 30 seconds to understand the question, to organize a response, and then be able to get it out in a way that's understood by other people. For their non-autistic counterparts, their non-autistic peers, that process is going to take about 5 seconds. So I just want you to think about how long 30 seconds actually is. That might not sound like a long time, but it really is. It's a good chunk that we often fill with repeating the question, or we ask if they heard us, or we ask if they understood, right? So if we don't account for that difference, we end up misreading what's actually happening. We assume they're ignoring us, or they didn't get it, they don't understand, all of those pieces. The other thing is that not everything needs to be verbal, right? And not everybody can access verbal or oral language. So in addition to formal non-speaking, formal communication tools or things that non-speaking folks might use, like specific communication apps or devices, spelling boards, those things are really helpful. Sometimes it's easier to write it down or to text or to use a scale or a visual model or just to point to something. Have you ever felt so overwhelmed that you just don't have any more words in order to be able to express something to someone? Like, I can't say one more thing, right? For many of our teens, writing or typing really gives them that space to actually access what they're thinking. Right? For me personally, and I incorporate lots of personal examples whenever we're talking, because this is real life. And I think it's important that we can relate and recognize these things. So for me, I'm a writer. If I'm upset about something, I can actually feel it in my fingers and I need to be able to get it out. But I'm not going to get it out by talking. I'm going to get it out by writing. That's my jam. Our teens all have different ways of doing that. More broadly, we want to widen that door for communication. So that might look like we are doing a parallel activity, right? We're talking while doing something else. We are watching a show together. We're sitting next to each other while doing different things, right? We do this a lot in our house. We're going for a drive. Some of the very best conversations that you're going to have with a teen happen in the car. Maybe we're sitting with them while they're playing a video game, right? Maybe we're sharing memes. Maybe we are sharing videos or we're texting back and forth, even in the same room. All of that is okay. The goal is to create a space where communication is the goal, right? Not verbal communication, but just communication is the goal. What tends not to work is, hey, come sit down, we need to talk. That's an immediate anxiety raiser. It's immediate shutdown. Connection doesn't always happen through direct conversation. Sometimes it happens through activities that we're doing together. Okay. And finally, how we're communicating matters. So a lot of our teens do better with very clear, direct language and concrete questions. So instead of, hey, how are you feeling? We might ask, was today harder? Was today easier? Or was it the same as yesterday? Right? Then they can pick one of the three. When we start shifting our communication, we're making it more likely that our teens are actually going to engage. And this really matters in depression care because if our teens don't have a way to express what's going on, it's always going to stay internal. We need them to be able to get it out. We also want to bring some of these adaptations into the therapy room. So if we can get them into the room, we want to be able to incorporate some of these things. So remember that we talked about CBT as a very traditional approach. We can use things like trauma-focused CBT that helps teens make connections, build coping strategies, and process difficult experiences. So that would be a question to ask a therapist. If you are a therapist, being able to incorporate those modalities are really are a lot more helpful. Okay. For our autistic teens, and this would include this can include using things like more visual or written supports. We are breaking things down into very concrete step-by-step pieces, and we are connecting everything that we do to real situations that they've experienced. So instead of this abstract discussion about thinking patterns, oh, do you tend to go in this direction when you're thinking? We have to get super real. So tell me what happened yesterday. What did you notice when? When you thought, I can't do this, what happened next? So we're being super, super clear in doing that. We're also focusing on identifying emotions. That is a huge piece that we have to consider. There is a complete misunderstanding that autistic teens don't understand emotions or they don't have emotions, and that is just not the case. But it is an area where many of our folks need support. And part of the reason for that is something called interoception. So that's that ability to notice and interpret what's happening inside your body. So that means our teens might feel things very, very strongly, but they might have a harder time recognizing or labeling what those sensations mean. So when we jump straight to tell me how you feel, we're asking for a skill that might not be fully developed or that they can't access. And so instead, what we want to do is really support that process. So that might look like we're providing emotion charts that give us some ideas, right? It might include using a visual scale. Where are you feeling on the scale right now? There is a very great mental health pain scale that sort of mimics the pain scale that happens, that gets used a lot in hospital settings. So that's a great tool to be able to use with some of our folks. We might be doing things like linking our feelings to our body sensations, right? Remember, I just told you when I get really, really upset and I need to write, I can actually feel it in my fingers. They need to itch, they need to move, I need to be able to get it out somehow. We want to be able to link those bodily sensations to our feelings. Or we're offering them concrete choices. Instead of how do you want to handle this? Here are a few options that we can choose, and we name them directly. Okay. If you can't identify what you're feeling, it's going to be really hard to regulate it. Another key modification is really around collaboration, especially with both the teen and the caregiver. So if what we're working on doesn't make sense to them or it doesn't feel really relevant to their experience, they're not going to engage with it, right? So we've got to build goals from the answers that our teens are giving us. And then we're always going to adjust based on the capacity, because if a teen is overwhelmed or if they're burnt out, that goal isn't going to, it's not going to materialize. They're not going to be able to push through. It's really about what's doable for them. That piece is always going, or let me rephrase that. This piece is might also include the caregiver, right? So as parents, you are part of this process, right? But your teen has to be open to that. You are the one that's seeing what's happening day to day, but your teen is the one that's experiencing it. So it becomes a shared process. That is always the goal in therapy. With your teen's consent, this looks like what's combining what your teen is experiencing right now with what you're observing day to day, and then what actually is going to work in real life. That collaboration is something that we have to be able to build. So in all of this, we are not changing necessarily what we're doing, we're changing how we're doing it. Right? Evidence-based therapy works best when it's access-based, when our teens can actually access that level of care. Okay. Beyond therapy, there are also ways that we can proactively support mental health by reducing stress and building protective factors. So up until now, we've been talking a lot about support and intervention, but we're going to talk more about a shift towards prevention and protection. A positive sense of identity is one of the strongest protective factors for mental health. So when a teen understands how their brain works, it changes absolutely everything for them. Without that understanding, a lot of our autistic teens tend to internalize their experiences more like I'm too much or I'm not enough. And over time, that can turn into things like shame and anxiety and depression, right? So when identity is framed in a strengths-based affirming way, those very same experiences can become things like I process things differently. This is how my brain works. I need different supports, right? I've got strengths that really matter to other people. The second piece to this is connection. So seeing other autistic people, especially adults who are living full, meaningful lives, really help teens understand that they are not alone and that this is actually possible for them, right? So that might look like highlighting books and social media or content creators who are openly autistic. Autistic peer groups are wonderful, right? Just hearing autistic voices that reflect their experience can be very meaningful. This starts a lot with the language that we're using. So instead of saying things like they have poor social skills, we might say they have a different communication style, because who gets to decide what good social skills are? Instead of saying that they're rigid, we might say that they really value predictability. It sounds like we're just kind of talking semantics, like we're just kind of putting, a rainbow on something that's very difficult. But we're not just playing with words, and we're not ignoring challenges. What we're doing is making sure that the challenges are not the only story that our teens are hearing. Okay. So building that positive autistic identity is very much a protective factor for against depression or other mental health issues. Okay. Let's move to special interests. I hate that term, but this is an area that's a very much misunderstood. When we talk about special interests, we're talking about deep, focused interests, right? Those are the things that bring a lot of meaning, a lot of enjoyment, a lot of engagement. Yes, you're going to hear the terms special interests, but like I said before, a lot of people prefer terms like focus interests or deep interests because these are really areas of passion and of expertise. They are not something unusual or problematic. They can be a very powerful form of regulation. Engaging in a deep interest can actually help calm the nervous system. It can help create predictability. It can bring a sense of stability. I want you to think about what you have, right? What are the things that you turn to when you're stressed? For some autistic teens, their deep interest often serves that very same function. For me, it's reading and writing, right? I'm never without a book. I'm never without a pen and a notebook. There's a very common fear that deep interests lead to isolation, but often they're actually the best pathway into connection. They can be a way to start conversations. They can be a way to connect with peers who share the interest. And I assure you that if your teen has the most obscure interest and you're like, there's no way that anyone else shares this, I promise you that there's someone that does. In our house, it's elevators. I told you before about the DVD collection. He can usually find some other people that are interested in movies and speak fluently in movie quotes, but elevators are the big other thing. And he has found people that have an interest in elevators and they're able to talk about them. I could tell you more about Otis brand elevators than anybody else, any other grown adult should, who is not an elevator engineer. But they can find those folks, right? It's really important that they have a way to connect with other people who share those same passions or similar ones and have a way to connect with you. So when we show an interest in what they care about, even just a little bit, we're meeting them where they are, right? Deep interests will also serve as a source of confidence, right? This is where so many of our teens feel successful. This is where they build skills. This is where they develop a sense of mastery. And that is so important for mental health. It directly will push back against those feelings of hopelessness and disconnection that we see in depression. So this last piece that we're going to look at is regulation. Okay, so this is where a lot of us get really stuck. A lot of what we're talking, or a lot about what we're taught, is actually these really generic coping skills. Things like take a deep breath, or punch a pillow, or listen to music. And yeah, sure, they can be helpful, but they don't always land. What actually works is a personalized regulation plan, an understanding of what your teen needs in this moment. So we always start by sensory mapping. So we figure out what overwhelms them and then what helps them feel more regulated, because regulation always starts in the body, right? I can tell you that when I walk in the house, if the hood that goes over your stove, I think that's all it's called, but if that exhaust fan is on, that is immediate sensory overload for me. If somebody left it on, or if somebody's cooking and that exhaust fan is on, I cannot tolerate any other sounds. That's it. Sends me into overdrive, right? So that would be something that I immediately would say, that's a sensory trigger for me. And that's going to make me feel really dysregulated. So we've got to look at what are some of those things that overwhelm them and then what helps them feel more regulated. Then we identify what those early warning signs are. What does it look like before things escalate? If we can catch things early, that's going to make the hugest difference. Then from there, we're going to build a regulation menu. right? So can we make a short list? We're not talking about 25 things. We don't need 20 strategies. A short list, 4 or 5 things, no more than that, that actually help your teen, right? Something that actually works for them. So just a few that you know are going to work to kind of bring them down. Then we're going to look at co-regulation. So co-regulation means that you are helping your teen regulate. It's not just telling them to calm down, right? I promise you that never works. We already talked about that. So this might look like just sitting with them quietly. This might look like helping them step away. You're letting them borrow your energy in order to bring them back to a place where they can actually think clearly. Okay. One of the things that we forget is that we are also real live human beings with real live nervous systems and real live feelings and emotions. And those sometimes get in the way of being able to support our teens because we're human, right? And so we have to get to a place where we're taking care of ourselves. And I know everybody hates the conversation about self-care. I hate that as a parent of an autistic kid myself, but this is real life here. So we have to get to a place where we can do that for ourselves so that way we can co-regulate with our teens. We are modeling for them in real time what that looks like. Then we can script out some supportive phrases, right? It is so hard to know what to say. Our kids are struggling. Our instinct is to protect. Our instinct is to make it go away. It's very helpful for us if we have some go-to phrases that we can lean on, right? So I tend to lean on, you don't have to talk, but I'm here when you're ready, right? I just sort of repeat that. With one of my kids, I often will say things like, do you want help or do you need some space right now? And space means, do you need some space to vent? Hey, I can see this is a lot right now. And we're just repeating that. We're not doing anything else. That's all we're doing, right? We're saying, take your time. We're not going anywhere, right? Or let's just focus on this one moment. And we're just bringing them back to that, right? So notice that absolutely none of those are about fixing the problem in the moment. They're really about just lowering pressure. They're about creating safety, and we're just helping them get to a more regulated space. Once they're in a more regulated space, then we can actively work on some problem solving. Okay. So last piece that I want to mention is chronic stress. For many of our autistic teens, depression is going to build over time, right? It's building from environments that are constantly overwhelming. So we ask, what are they coping with all day? Maybe it's school overload, right? A full school day can involve constant transitions, unpredictable sensory input, lots of academic demands, lots of social expectations. And for some, it's beyond overwhelming. So by the time they get home, their system's already depleted, right? Maybe it's social exhaustion. So even when things seem like they're going really well, there can be a whole lot of effort involved in reading social cues, right? Responding in ways that other people expect, and then sort of keeping up with conversation. That's a lot of effort that adds up, right? Then we think about unpredictability. So there's constant changes in schedules. That's just real life, right? Expectations aren't always clear, not knowing what's going to come next. All of that creates ongoing stress because the brain is constantly trying to figure out what's happening. What do I need to do right now? Right. And finally, there's masking fatigue. So a lot of our autistic teens are already working really hard to fit in. They're meeting expectations. They're hiding their differences. And that takes so much energy. This is where having that positive social identity really comes into play. So when they're masking all day, what you often see is they hold it together and then they crash at home, right? We can't out cope chronic overwhelm, right? It doesn't work that way. Know that we have one more poll for you, I think. Maybe we don't. That's okay. If you take nothing else from today, there are a couple of patterns that I want you to look for. So we've got increased irritability rather than sadness. Remember, you are way more likely to see frustration, reactivity, and shorter patience. I want you to remember that you're looking at changes in engagement. So it's not necessarily losing all interest, but you might see less interest in something that they used to love, or a change in how they engage with it, or that interest is becoming more isolating rather than regulating. So it's really important information when something that used to bring them joy and energy no longer does. The other sign I want you to keep an eye out for is that increased shutdown or reduced communication. So that might look like they're pulling away. There's less talking. And when I say talking, I want you to keep in mind that we're also talking about using alternative communication devices as talking, whatever their method of communication is. You might be seeing more time alone, not responding the way that they usually do. Again, this is about capacity. This is not about behavior choices. Okay. So if you're noticing those signs, there are 3 things that you can do right away. The first is that we are going to reduce demands. When our teens are struggling, the instinct is usually we need to get them back on track. But if their system is overwhelmed, adding more pressure is just going to make things worse. So this is a temporary move. We are not giving up expectations forever. We are just adjusting so they can actually meet them. The second one is we're going to lower the sensory load. So before we try to change behavior or solve everything all at once, we're going to take a look at what's around them. So we're going to reduce noise. We're going to reduce stimulation. Whatever it is that we noticed when we did our sensory map, those are the things that we're going to go to. We're going to simplify transitions. We're going to break things down to one-step directions. We're going to lower social pressure. They don't need to engage with everyone. If the environment is overwhelming, everything else is going to become that much harder. And then third, we're going to remember that talking is not always the most accessible way for teens to process, especially when they're overwhelmed. So instead, we're always going to offer alternatives, and we're going to honor those alternatives. Writing, drawing, going for a drive together, texting, typing, whatever it might be. The goal is to create the space where communication can happen. Okay. So as we wrap up, I encourage you to do this one thing, okay? We have a plan before things escalate. Doesn't need to be long, doesn't need to be complicated. It just needs to be personalized for your teen. And that plan is really just answering a few key questions. So what tends to trigger the overwhelm? What are the early signs that things are building? What actually helps your teen regulate? And it should include things that you're going to be able to do in that moment. So that way you're not trying to figure it out when things are already way up here, right? So we're not looking for generic coping skills because every single teen is different and that plan needs to reflect who they are. A very simple place to start is just asking, what does my teen need more of? And what do they need less of? What do we add? What can we take away? The goal here is not to prevent every hard moment. That's impossible, but it's to be prepared as much as possible for them. So when we start combining this with everything that we talk about, we're building a system that actually supports our teams. Okay. I know that in the chat, you'll find a link to download a safety plan template. Feel free to use it, adapt it to whatever it is that works best for you and your family. As we leave, I want to make sure that you're not just leaving with information, but with places to go next. There's a list of resources. We've got some books, we've got some articles, we've got some media that expand on what we talk about. On that list, you're going to notice that most, if not all of them, are from Autistic Voices. I really, really encourage you to include Autistic Voices in what you're reading and listening to, because that lived experience adds a layer of understanding that we don't always get from traditional resources. I would be remiss if I did not acknowledge that today is April 30th and is the very, very last day of Autism Acceptance Month. And so we don't do this in April just to be like, hey, it's Autism Acceptance Month, because that is something we need to be aware of year round. But I think it's a really relevant and timely conversation to be having. The last piece of everything is support, right? This is not something that you're meant to figure out on your own. That means that you also can seek your own support and should seek your own support. That might look like finding therapists who understand neurodiversity. It might look like school-based supports for your teen. Parent groups, right? Even just 1 or 2 people who get it can make a world of difference. Having support doesn't just help your teen, it helps you stay grounded too. So with all of that, I hope we hit on many of the key pieces that folks were hoping to hear about, and happy to answer questions. Lisa, I'll turn it back over to you.
Thank you so much, Sarah. Yes, we're going to get to the questions in just a minute, but first we want to encourage you to complete our survey. The link is here. We would love to hear what you thought about this program so we can improve future programs. You can submit any questions you might have for Sarah in the chat here as well as I go ahead and thank our funders for this program. We want to thank the Massachusetts Department of Public Health Suicide Prevention Program, the George Harrington Trust, the Middlesex Savings Charitable Foundation, the Thomas Anthony Pappas Charitable Foundation, the Rebecca Pomeroy Foundation, and the Bennett Family Foundation, as well as people like you, people who submit to Families for Depression Awareness. You can find that link on our website, familyaware.org/donate. And I think that was it for the things I needed to do. So there's a couple questions in the chat. I'm going to hit those first, and then we'll go to some of the questions that were submitted from people online. I apologize if I mispronounced your name, but it's either, I think it's Rocio or Rocchio. And there are two questions here, so I'll put them together. The first is asking for help to advocate for my neurodivergent young adult to encourage and be supportive of mental health. I hope that you got some ideas from this webinar. And also, has found several therapists, but child is not interested and discontinues. So that pattern of starting therapy and maybe not continuing therapy. Sarah, if you have any input into that.
Sorry, I was trying to unmute myself. Yeah, I would think that after several years of doing
I
Zoom
know.
that I'd be able to do that, right? So let's start with the teen or the young adult that might start therapy and then sort of discontinue. So if they're not interested in therapy, pushing harder is usually going to backfire. But doing nothing really isn't the answer either. So one of the things that we can do is really taking a look at what are the barriers, right? Are they pulling themselves out of therapy because they've had bad experiences? Have they felt like it's been invalidating? You'd be shocked at how much just validating somebody's experience actually has been really helpful. Do they just not see the point? Are they feeling like they're not getting anything out of it? Are they exhausted? Is it just one more thing that's on their list? So we've got to name that directly for them. A lot of people don't like therapy because it hasn't actually helped them, and that makes sense. But we validate for them, right? So we have to stop looking at therapy as the only door. Support can look a lot like mentoring relationships, coaching, interest-based groups, online communities, skill-based supports. Do they need executive functioning help? Do they need life skills? Sometimes therapy becomes like a step 3 or 4 down the way, right? If they are remotely interested in sessions, maybe it's not weekly sessions, right? Maybe we're looking for monthly sessions. Maybe we're looking at changing the format. If they're meeting in person, maybe we're switching to meeting virtually. Maybe we're working with a therapist to understand that they don't have to talk, they just need to show up, right? That's the only thing that we're looking for them to do right now. Maybe it's just trying to find someone that they don't hate talking to. Right? It sounds silly, but sometimes that's what it is. And so then we work with what they actually care about, right? So if we lead with you're depressed and I'm so concerned about your depression and your mental health, we're going to lose them. But if we lead with, hey, I'm worried about your sleep patterns, that seems to be getting in the way for you. I'm wondering if someone could help us with that. I'm worried about how much stress you're under at school or at work. You know, I'm wondering about the relationships that you're in, how stressful those seem to be. You're more likely to get buy-in that way if we're naming those things directly. And so even if you can't get them into therapy, if it's teen, it's young adult, sometimes it's finding your own support, right? To work on your own communication with them, to look at like how you're handling the expectations, if there's conflict going on, sometimes just creating a more regulating environment. And that alone can really help reduce some of those symptoms. So I hope that helped that piece.
That's great. Thank you. Another question from an anonymous attendee. Could communication patterns be triggering for a teen? Could changing the word influence a different behavior?
Oh, communication is is a huge trigger for a lot of people. So if you mean changing the word, like when you're talking to them, like changing the way that you're describing something, yes, that can absolutely change the outcome in a positive way, in a negative way. Um, so without knowing, it sounds like there might be a specific situation there, but communication in general, so without knowing specifics, communication in general with our autistic teens really should be concrete and direct. So say what you mean, be clear about what it is that you're saying, as opposed to kind of softening our language. We tend to do that when we're talking about feelings and depression. We kind of, I'm going to use a metaphor because I don't have another one for it, but we sort of beat around the bush. And we don't want to do that, right? Get at what you're trying to say. It might feel harsh if you are somebody who doesn't typically communicate that way. But for our autistic teens, it's actually very much respected because they know what they're getting from you. So yes, changing the way that you're saying things, changing the wording of how you say things absolutely makes a big difference.
This is actually a question I'm going to add on to that. Using the actual word suicide, I know there are a lot of people that have feelings about that. Could you talk a little bit about that direct word?
So using the word suicide does not make somebody want to die by suicide. Using the word suicide puts a word to feelings that were already there. It's not something that should be um we shouldn't hide behind that word. So when we use euphemisms like, do you want to hurt yourself? Right? Well, what does that actually mean? Hurting yourself has a whole list of descriptors, and we're not actually getting at what we're trying to understand about the person. There's a very big difference between I get so angry that I want to put my fist through a wall, that's hurting yourself, and I want to die. So using that word suicide, explaining what it means can open a whole other level of conversation that is so important to have. So it's uncomfortable for us, but really, I encourage folks to use that language when you're talking with your teens about them. They get it. And if they're feeling it, it's already there. It's not going to create the feeling.
Thank you. Another question, is DBT a good therapy for autistic teens?
Okay. So I don't want to say that any modality, aside from very strict compliance-based behavioral approaches, are not good for autistic teens. Most therapies, including DBT, can absolutely be adapted to support autistic individuals. There's actually some really great resources in adapting DBT for autistic individuals. There's a book called The Neurodivergent Friendly Book of DBT Skills. I hope I got that right. It's by Sunny Jane Wise. But what it does is it breaks down all of the steps in DBT into very clear, specific language. And the other thing that's in there is that it doesn't really, DBT can be modified for autistic teams to not really focus so heavily on the interpersonal piece, and more on the internal experiences. So that's the more important piece of it, being able to develop those skill sets in order to be able to kind of figure out. So short answer, yes, DBT is good, but just like any modality can be good with some adaptations to the person they're actually working with.
That makes sense. Another question here in the chat. How do I figure out if a therapist truly has experience with autism? Many therapists have said they are experienced, but they were not. This has led to my daughter thinking she fails at therapy.
Oh, I would ask them what their experience is. So sometimes that sort of becomes, oh, well, I worked in a school with autistic children. Okay, but that's not the same as providing therapy with autistic teens. I would ask more questions about what their approaches are, as opposed to, do you have experience with autism? Like, how would you handle if my teen goes nonverbal in your session? How would you handle if my teen can't get out of the car to come into the session? What if we're meeting virtually and my teen doesn't want to turn on the camera? So I would ask things that happen frequently for your teen, and then ask the therapist how they would handle that. I would also ask them about their communication style, right? So are you a clear, direct communicator? Are you somebody that's sort of a blank slate therapist that doesn't really offer a whole lot of back and forth? I would ask them more about their style and their approaches than just, do you have experience with autism? Right. And I'm
That's
so
great.
sorry that your daughter feels like she fails at therapy.
No,
Nobody should ever feel that way.
no. That's great advice. Thank you, Sarah. A couple questions that were submitted ahead of time. Does all this knowledge apply to ADHD depression?
So, yes, with the caveat that there's a little bit of a difference there. So, there isn't a huge overlap between autism and ADHD and depression, but our ADHDers tend to that depression often comes from repeated experiences of what they perceive as failure, executive functioning overwhelm. That is a big one. Those shame cycles of I just can't keep up, right? Where our autistic depression often comes from things like masking and sensory overload, that social exhaustion. So, with both, we're not treating depression in general. Well, with anything, we're treating depression in the context of how that person's brain is experiencing the world. So yes, but also there's a lot more nuance there, right? So we're tailoring treatment to how that person experiences things.
Thank you. And I believe there's a webinar on depression and
Yes.
ADHD in the chat there. Another question. Do you have any tips or strategies for providing psychoeducation to teens and their families about depression in autistic folks?
So number one strategy, make it really concrete. So don't say things like, "Oh, it's just low mood." You might want to say things like, "It feels like does it feel like everything takes three times more the energy that it normally did? Are you feeling like things you used to care about just really aren't there anymore?" We want to use some comparison language that can be really helpful. And I would just explain like this is the difference between burnout and anxiety and depression, right? Teens in general, including our autistic teens, need to have some contrast in order to be able to understand things, right? They have to be able to compare it to something else. One of the other things that we tend to do is we try to externalize it as much as possible, especially with our autistic teens who can often be very literal thinkers. So we want to explain that depression is something that is happening to their brain. It is not something that is living in their brain. We've heard horror stories about folks kind of hearing that depression is who they are and it's something that lives inside your brain. And that has led to really confusing and scary incidents where teens are feeling like they have to eliminate that part of themselves, as opposed to this is something that's happening right now and we're going to treat it. Right. Visuals always help. Visuals make everything better. I am very much a visual person. I live and die by my planner and my sticky notes. So whenever you can make something visual, the better. Things like there's some really great resources online that you can find for like a window of tolerance that can kind of show like how much somebody can handle at any given time, and that can be a good lead into that discussion. There's some really great Autism Level Up has some really great visuals around energy meters that you can use in order to have that conversation with your teen, right? About where their energy level is at any given time. So anytime you can incorporate a visual, that can be extremely helpful. And then we want to make sure that we're not talking at them. Like, let's not lecture at our teens. If you ever had a teen, you know that lecturing at them isn't going to fly for anything. Definitely not when we're talking about feelings and depression, right? So we want to make sure that we're talking with them and not just at them. And then normalize it, right? This is something that so many people deal with, right? And when we normalize and validate for people like, yeah, of course you're feeling this way. Like this makes a lot of sense because you're dealing with so much. Here are the things that are happening. Like I get it. So just being able to say like, you're not the only one. There's so much power and strength in that. And that in and of itself can be really helpful in describing what depression looks like. So I hope that helps.
That's great. And someone in the chat here says, can gentle humor approaches help with depression? Which is sort of,
Yeah.
continuing what you just said. Yeah.
I,
Normalizing
I,
it.
I am a sarcasm is my love language. That has to be your teen's love language in order for you to use it. But humor goes a long way, right?
Absolutely.
Absolutely.
How can I help my teen determine if their antidepressant is working? Any tips on helping a teen as they wait between appointments?
So what you're really looking for there is not a like, hey, I was sad and now I'm suddenly happy, because that's not going to happen. So I would actually encourage them to have a mood tracker, or you keep a mood tracker for them, but you're talking to them every time, because sometimes what'll happen is you'll have an appointment, you get prescribed an SSRI, say, and then you have another appointment 4 to 6 weeks later. And it's really difficult to judge whether or not it's been helpful in that 4 to 6 weeks. So if you have a couple of things that you're looking for, maybe it's irritability, maybe it's energy level, maybe it's like a slight increase in engagement. Do they feel like they can do something a little bit more? And you can just rate those one, two, or three things on how they are every couple of days. You'll have some better information to go back to, because sometimes what'll happen is you get to that appointment and the only thing you can really remember is like the last week, and maybe that last week was really hard, right? But that's not necessarily indicative of everything that's happened. So you're looking for small movement, not transformation, right? So a lot of times we'll start looking at things like, oh, they're still really sensory overloaded, or they're burnt out. And if that's what we're looking at, then no, it's not going to look like meds are helping. So we want to make sure that we're kind of isolating those very specific things that we're hoping the meds can be helpful with, and then judging them, every day or every few days to get a better picture.
That's great. And our last question before we wrap up here, what do you recommend for teens who decline social activities when they are already isolated and depressed?
Okay, so we need a middle ground here. We we know that it is very difficult to kind of get folks out of a space where they feel like they can't engage with anything. And so behavioral activation is my favorite thing. So first we remember that if they are avoiding or they're isolating, that what they're doing is they're protecting themselves, right? So we want to shrink the ask. So instead of like, oh, you don't go hang out with your friends anymore, or come out in the living room, watch a movie with us. Instead, we're really just looking at one small little thing. So maybe we're asking if they've texted a friend, right? Maybe we're asking them to come sit with us for 10 minutes, not a full 2-hour movie. Maybe we are getting them to engage with us through text instead of just going in their room and talking to them. Maybe it's outlining very small, like changes in spaces where they might be a little bit more comfortable. So again, we're doing this very incrementally. So maybe like a loud, unpredictable space is not going to be the thing for them. Maybe you live in a home where there are multiple children, like my house, and coming to hang out in the living room is not going to be the place that's going to work. But maybe we're going to go and pick up an order at Target. And so do you want to come with me for a ride, right? Structured, low demand. We're not asking a whole lot. Maybe that's the thing that we can do. Using a parallel connection, like we had started talking about before, can be really helpful. So just doing something side by side. Maybe they're playing a video game and we're just hanging out with them, being weird while they're playing their video game. That reduces a lot of that social pressure, right? And I think anytime you can tie it to their interests, that is helpful. Very critical for autistic teens. So we're connecting through their shared interests instead of forcing socialization, right? Like, hey, you're playing with, I don't know, trains is the only thing that came to mind, and that was so epically stereotypical. But hey, tell me about these right now. Again, with anything, we validate, right? We validate, this feels like a lot. I know this feels like a lot, but what would make this feel 10% more doable right now, right? So we don't want to push them back into the world like as things are, right? We want to just slowly rebuild a version that can actually fit their capacity in that moment.
That's
Right?
wonderful.
And be weird. Don't be afraid of being weird.
Amen. Amen.
Do
Well,
it.
from all of us here at Families for Depression Awareness, thank you so much to Sara, to Dr. Rodrigues, and everyone who watched live or is going to watch this recording later. We hope this information empowers you, your loved ones, and your family. All people deserve a life well lived. If you'd like to keep learning with us, please go to our website, familyaware.org, and sign up for our newsletter. And we look forward to seeing you in a future webinar. Thank you very much.